they go on to talk about, and again, this is a great article if you get a chance to take a look at it. Is digital health the leading future modality? And then they go through, let's see, 7 modalities. Okay, urgent care, primary care, diagnostics and pharmacy, specialty care, procedure and surgeries, acute, post-acute care, navigation and guidance. And they talk about each one in the context of telehealth. Give you an example, urgent care. This is perhaps the best known use case for digital care today, popularized by innovations such as Amwell, Teladoc, and others. Urgent care includes the basic, often transactional care designed to solve low-level acute need. With traditional challenges of remote diagnostics falling away, the new connected devices, a digital modality for this use case, is becoming more prevalent. We know that. Primary care. In contrast to urgent care's transactional nature, primary care is about longitudinal provider-patient relationships and holistic health management. There are critical elements that would likely retain their importance, particularly for a subset of older, sicker patient populations. Still, as recent experience has shown, the vast majority of visits can be performed digitally in various synchronous phone, video, or asynchronous modes, even for these high-need populations, right? They talk about diagnostics and pharmacy. While the use case generates significant economic value for health systems today, there's a limited need for a digital-oriented health system to own these assets. Patients can be referred to and scheduled for local operators for imaging studies, specimen collection, and the like. Specialty care, another modality. The office-based portion of non-procedural surgical specialty care is another case where most services can be and often have been delivered digitally. A direct physical examination is needed prior to a decision for a surgical procedure, and therefore a small physical footprint will be needed. However, the pre-screening of patients for elective surgery, especially those cases such as back surgery, where a substantial number of patients may not wish to have surgery, can be done remotely. So they even talk about that modality and its digital possibilities. Procedures and surgeries. On the surface, this use case is the most challenging to deliver digitally. And I'm sure right now what you're thinking is, oh yeah, we're going to put a Da Vinci in the home and a physician. No, we're not going to do that. While the care needs to be delivered physically, many services are technical, procedural in nature, and thus lend themselves well to subcontracting with local operators in the same vein as imaging studies. This includes services where the specialist presence is not required, such as infusion, or even those where the procedure is becoming a commodity and given a satisfactory level of quality and safety. Keep in mind, they're talking about, is it possible to have a digital-only health system that outsources services? All right, so acute and post-acute care. Despite the above, there will be times when acute care settings, whether emergent or post-surgical need, will be required, absolutely. However, as large multi-specialty physician groups have been demonstrating for years, it is possible to nurture long-term patient relationships, including the occasional hospital stay, without operating one. Okay, and then they go on to talk about where digital falls into that. Navigation and guidance. A health system not spending mind share and capital in managing vast and depreciating physical assets can devote attention to building a sophisticated and consumer-friendly care experience and actively support the patient along their health journey. So navigation and guidance clearly can be digital. In summary, a digital-oriented health system can meet the needs of its patients with limited to no owned physical assets. Can you imagine that? A digital-oriented health system can meet the needs of its patients with limited to no owned physical assets. When physical care is required, it can be sourced locally from operators. The key deciding factor whether to own any local talent in a market will be whether the system wants to be physically intense episodes of care where specialists are forming strong patient relationships over a period of time with patients. You know, if nothing else, this is really thought-provoking. And if I were the CEO of a health system, I would probably be asking these people to come in to speak with me. The so what, and I'm going to take this back to an existing health system today. The so what is that models for care are changing all around us. And we should be re-examining our models for care, not sprinting back to the models of care that we had in December of last year.